In the biggest sign yet that the pandemic is behind us, the CDC has announced that people who are getting better after testing positive for COVID no longer need to be in quarantine for 5 days before going out and about. I think that this is a wise move. Let's talk about it. Hey, everybody, it's Dr. David. Hope you are having a great day out there. I realize that COVID guidelines is not something that a lot of people have been following for a while. But of course, the CDC keeps on making statements as to what the recommendations are to give people some level of guidance. And obviously, people can choose to follow them or they can choose not to. Now, as somebody, as a pediatrician who, of course, has been dealing with this on the ground since day one, but also recognizing that children are the least likely to be sick from COVID, overly sick, but at the same time, they may be exposing other people like teachers or grandparents or other people who are infirmed. This has been a conversation that's been happening, on a weekly basis for me since the very beginning of this. So I want to go into a little bit more. So we're going to talk about the statistics that support the CDC's recommendation for making these changes in terms of when a person can go out into civilization again. We're going to talk about what these guidelines themselves are and what the reality of the situation is itself. So, at the start of the pandemic, there were a lot of recommendations that were being made. And of course, back then it was based more upon instincts, reasoning, but not based upon numbers. Because, of course, we didn't have numbers. So, I do have a lot of grace for people at the CDC and health officials who were trying to make the best of an impossible situation. And obviously, we heard back and forth information about vaccines, and we heard back and forth information about masks, quarantines, all of these types of things. Let's face it, people were spraying down their boxes and cleaning surfaces until we found out that that wasn't the way that COVID was being spread. But we didn't know at the beginning. So, of course, that's going to be a novel virus. Remember, it was called novel because it was new. We didn't have other information to go upon. Okay. Now, as far as what some of these statistics themselves are, a couple things. So, also back then, if you remember, thousands of people were dying a day. So, of course, rather fast decisions needed to be made to try to stop that, which, let's face it, the numbers did go down, so that was good. But also part of the issue as to was that our health departments, our health system wasn't able to keep up with all of the morbidity, the hospitalizations, all of this. So, of course, that was really challenging too. Remember, we talked about bending the curve so that the health system can handle the number of people who are being not just infected, but who are getting sick. Okay, so let's talk first about the statistics, because I think that's important to recognize where we are at this point. So first of all, just in terms of severe outcomes, they have been dropping quite remarkably since 2020, 2021. In particular, hospitalizations. In 2021, at the peak, there were about 2.5 million hospitalizations that were occurring for COVID. During that year, and then by 2013, by 2023, the number dropped 60% to 900,000 hospitalizations. So that was obviously a clear improvement, 60% reduction. Deaths, okay? In 2021, there were 450,000 deaths due to COVID-19. I know there's been the conversations of deaths from COVID versus death with COVID or hospitalizations with, but these are the death numbers that were attributed to complications specifically to COVID. Okay, by 2023, the number dropped 83%, and there were about 75,000 deaths. So again, a huge number telling us that we were being immune to it, or it wasn't as strong, but certainly wasn't dealing with it. There were treatments that were available, etc. Okay, and then even cause of death. So back in 2020 and 2021, there COVID was the third leading cause of death in our country. Okay. Now in 2023, the most recent numbers, and they're still a little preliminary since we're early in 2024, but it's estimated that it was the 10th leading cause of death. So from third leading cause to 10th leading cause, with all of the variables kind of being the same. Okay, so now what are these CDC guidelines? So people who have COVID-19, obviously testing would confirm it. But if a person has COVID-19, whether they test positive or highly suspected, most important thing is to stay home until a person is fever-free for at least 24 hours, and the symptoms themselves have been improving for at least 24 hours. Okay, but now the CDC says if those two criteria are met, that a person can resume their regular activities. They can be out and about. It does, obviously it may be 5 days because you maybe have fever for a few days and be a few days, before you're getting better. So you may be there, but just because the 5-day number is just a sheer number itself, that's no longer where things are at. Okay. Now, of course, if you've been recently sick with COVID, you are going to still be contagious, right? It's not like after 5 days it completely, but some people even went longer while they're still contagious. So, of course, there are additional precautions a person can take, such as being improved ventilation. We've talked about having not just good filtration, but having open windows, fans, circulating air, keeping the air moving, being in larger spaces as opposed to smaller spaces, etc. Okay. Wearing a mask. Masking may not be so protective for people who are trying to avoid getting it, but the fibers that are within the mask does catch it. Not as much virus will be put into the air if a person is still contagious if they're wearing a mask. Okay. And of course, limiting close contact to others, especially people who are infirmed or at high risk in one level or another. And of course, that's kind of true regarding any virus, which we're going to talk a little bit more about this more global recommendation instead. Okay. But also, if you take a step back, you remember that the CDC, that the first recommendations was if you tested positive, 10 full days of quarantine, of isolation. Okay. Then after time, they changed it. They said 5 full days of quarantine and then 5 days followed by 5 days of masking if going to be around other people. And now, of course, we have these new guidelines, which are by far the most liberalized guidelines that we've seen. Okay. Now, the guidelines themselves are particularly important for those who are around vulnerable individuals. So we're talking about the elderly, people have low immune systems, whether it's a congenital immune problem, whether they're taking medications, immunotherapies, chemotherapies, etc., immunobiologicals. But of course, people who have cancer, especially if they've had certain terms of cancer, they may be long-term immunosuppressed. So that would be true even after treatment is over. And of course, the high risk that we've talked about: diabetes, obesity, pulmonary disease, cardiovascular disease as well. Okay, so now what about testing? Okay, so according to a recent CDC survey, which I think is part of why all this changed, less than half the people said that they would use, at this point in time, less than half people said that they would even bother to do an at-home COVID test if they got new cough or cold symptoms. Okay, so already most people aren't testing. And that's kind of what they did with this new recommendation is they made it more generalized. So the recommendations isn't even specific for COVID now when it comes to this isolation. It's for general respiratory illnesses. And whether a person has the flu, whether a person has RSV, adenovirus, all kinds of respiratory viruses in general, if you have a fever, you shouldn't be around other people. You should wait until you start to feel better before you're around other people. So this is just good general sense, and now everything kind of conforms into one place. Okay, so it's kind of a group now of people, not just the one disease. Now, in terms of testing for COVID, why would you test? Well, number one, in case you just want to know, right? Or if you're going to potentially be around people who are more at risk, you kind of want to know going in, or to let people know that you were positive. Let them decide whether they're okay with being around you. Maybe they don't want to come around you until you've been further along, but I think we should respect other people and let them know what's going on with us. Okay. Now, of course, another reason why a person would do it is if they were going to take a specific COVID treatment. Okay. Now, I know we've talked way in the past about monoclonal antibodies. At this point in time, there are no specific monoclonal antibodies that target the current variants that are around. Okay. Now, there's also Paxlovid. Paxlovid does work. I know people talk back and forth of it. There's research that shows that the rebound that people have from Paxlovid, after Paxlovid, also happens from people who have the disease itself who never got treated with Paxlovid. So it's just that for some people it comes back. Okay. Although some people do say maybe it should be going for longer than 5 days. Okay. Other considerations: pregnancy. Be on alert because people who are pregnant, if they catch COVID, it is 2.5 more times likely that they're going to be hospitalized. So being around somebody who's pregnant, or if you are, pregnant, obviously you can't take Paxlovid, you can't take certain things, but just be aware that the likelihood of escalation is higher in the pregnant state. Okay. Now, other considerations. Usually if we're saying just kind of hang out at home, people can get strep throat. Strep throat should be treated with an antibiotic no matter what, if it's positive. Not just because you have a sore throat, not because it looks red, not because it looks pus. Viruses can do that too. But if you test positive for strep, antibiotics for, and again, at least a couple days with no fever and on the antibiotics before you can go back. Measles, which in the news, we'll talk about that too, right? If it starts off like a flu. So you do not know that you have measles if you have measles, at least at the very beginning. In fact, the contagiousness is from 4 days before until 4 days after the rash comes out, but that comes out a couple weeks after a person starts to get sick even. So that's not a very reliable thing if you're waiting for that. But I realize we're talking measles, about a very, very, very unlikely type of infection for people to get. But since it's in the news, I figured I'd talk about it. Now, why did they resolve these guidelines in the first place? Okay, number one, most people weren't following the old guidelines, so they figured, well, maybe they can come up with something that's more simple that people will cover. That maybe it'll help some people out, even if it wasn't working as well as if they were more strict. Okay. Many people found those other guidelines confusing. 5 days in quarantine, masking, do you have a fever? Did you get worse? And people were not understanding. I had to keep on looking it up, and I was talking to people about this every day, but I'm like, where are we at this week? I don't even remember now. In terms of, the reality is that lots of states, lots of countries have already gone away from that 5-day mandatory quarantine. So in a way, the CDC just kind of came in line with what most of the country was doing anyway. Okay. But in those countries where they did away with this and made and shortened this whole isolation period, there has not been an increase in hospitalizations or deaths from COVID-19 in those states, communities, countries where they did that. Okay. And again, they just kind of decided to roll this all into one as respiratory illnesses. So, as I said, the influenza, RSV, it's good advice for any respiratory infection. And so if it's single, maybe people will follow it more, but certainly the recommendations of don't be at school or work with a fever until you're getting better. I mean, that just seems like common sense, and something I would definitely endorse. So overall, as I said, I do believe that these are good guidelines. I'm glad to see that this update was done. Hopefully, with everybody being on the same page, we'll at least have an understanding. And of course, don't go to school or work with the fever or when you're sick is not so much a political thing, right? Everything else in COVID got political. Maybe this is one we can decide is not apolitical one way or the other in terms of following these most basic guidelines. Okay. But still, each case is unique. Follow your instincts. Logic, reasoning gets you pretty far in life. So, take a step back and say, does this make sense for me? Does this make sense for my family? Okay. Starting our immune support protocol in the first signs of illness does a great job of warding off more severe and prolonged infections. And of course, we've talked about how our patients have access to that in the patient portal. Our Patreon subscribers, if you're not, please do have access to it there. And just, really important to get this information. And of course, sign up for this YouTube channel. If you're not subscribed already, please share with other people. We'd like to get this information out to as many people as possible. All right, now maybe you have some other food for thought for the next time COVID comes around. Have a great day.